So welcome to the second section of Unit 2 on spirituality and care, spirituality and care. While in the first section, we mainly focused on some basic concepts to understand this relation between spirituality and care, concepts developed in medical anthropology, such as the medical system, therapeutic pluralism, and spiritual healing. We are now going to briefly discuss one of the most important and most well-known concept in the anthropology of medicine. That is this triad of disease, illness, and sickness. So we are going to reconceptualize in a way the way we define disease and the way we attribute different meanings to this situation of malaise. So we need to, first of all, consider the way biomedicine constructs its knowledge basing on dichotomies. So although this can be oversimplified, we have this normal and abnormal, healthy and pathological, order and disorder dichotomies that mark the kind of knowledge and also the kind of response to malaise that biomedicine have been developing throughout its history. Yet, what medical anthropology tries to stress in its works is that these boundaries, these thresholds between what is health and what is disease is social construction. So we define these boundaries of what is normal and what is abnormal, and in this way, creating these categories, we locate specific conditions, specific individuals, or groups within one or the other condition of normality, health, and order, or the condition of abnormality, pathology, and disorder. So medical anthropology states that disease is not an objective category, while biomedicine aims at defining and treating disease as an objective datum based on quantitative parameters like the body temperature, blood pressure, and levels of cholesterol, and so on. Medical anthropology states that the diagnostic process is an interpretative one, and that it is important, it is central to this process also to provide meaning to the patient's symptoms, and not only to quantify and responding to them through a reduction to objective parameters. So while in biomedicine, generally speaking, little attention is paid to this kind of subjective data and to their interpretation, and so to the patient's experience of malaise, medical anthropology focuses especially on this. So the two basic dimensions that should be added, not to substitute, but to integrate our knowledge and our way of confronting and of understanding disease, is to focus on this subjective experience on the one side and on the social dimensions of malaise on the other side. That's where this triad, disease, illness, and sickness, comes from. While in Italian, for example, we use just one word, malattia, in order to define these three different aspects, three different dimensions of malaise. In the language of medical anthropology, these three different elements have been defined and identified. So we have the organic dimension of disease, the one on which biomedicine especially focuses. Then we have the subjective individual experience of this disease, that is illness. So illness is the specific focus on the individual and the individuality of the experience of disease. So we can say, for example, that 100 patients having the same disease, so the same organic problem, let's say, have 100 different illnesses, 100 different ways of understanding, of living, of experiencing the status of patient, their experience of disease. And then we have the social dimension of disease, sickness. How this disease is the social meaning of feeling bad, the interpretation that a given society provides to a specific disease. And the interaction between these three dimensions are central to understand the approach medical anthropology has to states of malaise, and also the way this malaise should be understood from a holistic perspective. So when we deal with these different dimensions of malaise, we have to recognize the interconnectedness of these different parts of the human being. So instead of conceiving the body as sort of machine that can be repaired with the appropriate technological means, if we conceive disease as a complex interaction between these different dimensions, so the organic dimension, the individual experience, and the social representation of the malaise, then we need also to recognize that healing is something much more complex than just repairing a non-functioning part of the body. And that a comprehensive approach to healing and a comprehensive approach to care should take into consideration these different dimensions, disease, illness, and sickness, and also the different dimensions in the individual body, mind, and spirit. And here is where we can go back to therapeutic pluralism again, that is the main focus of this unit. Comparing to biomedicine, that of course had extraordinarily successful approach to certain kind of disease, but comparing this reductive view of biomedicine to the kind of holistic view of care that is present in many complementary and unconventional medicines, and to many traditional medicines, as we call them, we can see that there are some characteristics that marks these kind of non-biomedical traditions. So we have these 5 characteristics very quickly: a natural approach without administration of artificially synthesized drugs. We have an holistic approach where the unity of body, mind, and spirit is central to understanding of the disease, and this will be especially important for understanding spiritual healing in the next section. We have an individual approach, so no reduction to a standard patient. We have an active role in the responsibility of the patient, and the idea that the body is composed of an energy, and that healing is restoring the balance of this energy. And finally, we have also the idea that is much present in many medical systems, that disease and healing, disease and therapeutic processes have to be understood in a relational way, so that it's not only the individual that faces the disease, but a social group that is at the center of both the conception and of the treatment of disease.